COVID 19 is like a bad nightmare. It's more like a mass nightmare, I suppose. It's like a series of problems, not just one. I talked about how long does the long COVID last and the potential kidney disorders in a previous post. But today on World Heart Day, I am writing about the cardiac issues of long COVID and I thought I would create a podcast around it. With more data being available about the nature of COVID, it's not surprising that the tail end risk of an asymptomatic COVID 19 infection is also significant. Hi, I'm Dr. Amrita, and you're listening to the Health Wealth Bridge podcast. Since the COVID 19 pandemic started and data was collected about acute and chronic symptoms, doctors all over the world were even more sure that prevention was still your best friend. So, who exactly can have long COVID? The risk of long COVID is 2 times higher in women compared to men. Increasing age makes you more susceptible. 50 to 69 years old people have been found to be more susceptible to long COVID. The presence of more than 5 symptoms in the acute infection is associated with an increased risk of developing long COVID. Associated comorbidities like hypertension, diabetes, obesity increase the risk of long COVID. Asymptomatic and mildly symptomatic people also may develop the problem of long COVID. What are the symptoms of long COVID? In people with this, one or more symptoms may be present even after 12 weeks. That's the guideline for chronicity. Extreme fatigue, headache, joint pain, myalgia and weakness, insomnia, pins and needles are common. Breathlessness, cough, hoarseness, vocal fatigue, chest pain or palpitations may also be there. You might also have diarrhea, rash or hair loss. Neurocognitive problems like memory issues, brain fog, concentration problems and a generalized worsening of the quality of life. Impaired balance and gait has also been seen. You might have a combination of multiple of these symptoms. The 5 most common long COVID symptoms are fatigue, headache, dyspnea, that is difficulty breathing, hoarse voice, and myalgia, that is muscle pain. Long COVID is now classified into 3 very big categories depending on the most troublesome and persistent symptoms. They are post-COVID cardiorespiratory syndrome, post-COVID fatigue syndrome, post-COVID neuropsychiatric syndrome. All this has been talked about in detail in a PubMed article and also in a Government of UK new journal that has been published, and both the links are there in the description below. The interesting thing about long COVID is it can even occur in people who had an asymptomatic acute phase. The common cardiac symptoms in patients with suspected long COVID are a labile heart rate and blood pressure response. Labile meaning it's inconsistent. Myocarditis, pericarditis, myocardial fibrosis, myocardial infarction, cardiac failure, arrhythmias, sudden cardiac death. Coronary artery aneurysm, aortic aneurysm, accelerated atherosclerosis, venous and arterial thromboembolic disease, and life-threatening pulmonary embolism may also occur. These problems may happen singly or together. On World Heart Day, this is a good opportunity to be more aware about the many heart problems that long COVID is bringing. The test required will depend on symptoms and signs but can include serial clinical monitoring of blood pressure and pulse, electrocardiogram, echocardiogram, a cardiac MRI, an HRCT chest for suspected respiratory pathology, pulmonary function tests. Wearing a mask, getting vaccinated, staying healthy are your best bet. You were listening to the Health Well Bridge podcast hosted on Anchor.